Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Good morning. I am Dr. Riyaz. I'm a physician. I'm working in Director of Health Services, Kashmir. Today's topic is, it's an hypertension topic, which is very important. Almost half of the population throughout the world at one stage of the time suffers with hypertension.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Hypertension often does not cause symptoms until significant damage has occurred. Just because you feel fine does not mean your blood vessels, heart, kidney, or brain are unaffected. Consistently high BP strains your arteries, making them less elastic, means the elasticity of the arteries are decreased, which can lead to serious issues like heart attack, strokes, even kidney failure. And even if you have never felt a thing, it's like having a fire behind the wall. Just because you do not see smoke does not mean nothing is burning. It means that once a patient is suffering from hypertension, he does not have any symptoms, but the changes in arteries are going there. They're definitely there. So, knowing hypertension is very important. If you know the numbers, means if you know how much blood pressure a patient has, we can control it. And if you control it at initial stage, definitely you will prevent such episodes in later life.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
See, it's called the silent killer because people can live with dangerously high BP for years without knowing it. Thinking of it as rust inside your pipes. We can say that if you have a pipe, if there's a rust inside it, what does it do? It may not be visible, but it weakens the system. If untreated, it significantly increases the risk of heart attacks, strokes, kidney failure, and even dementia. According to the World Health Organization, hypertension is responsible for approximately 10.8 million deaths globally. So, many of which are preventable. And if you see Indian scenario, it is responsible for 57% of stroke deaths and 24% of coronary heart disease deaths. It means why it is called silent killer. I have already told that since it does not have prominent symptoms like we have coming patients in our clinics or OPD with headache, giddiness, neck pain. The first question they ask, please check my BP. I think I'm suffering from BP. I'm suffering from hypertension. But once we check the BP, most of them, they have a normal BP. So it means that having headache, having neck pain, having giddiness are not usually associated with hypertension. Hypertension usually is a symptomless disease. Once we say symptoms of hypertension, it's usually stroke, it is heart failure, it's heart attack, it's renal failure, and sometimes blindness.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
See, if you see the cause of blood pressure, it's usually a combination of genetics and lifestyle. About 90 to 95% of hypertension cases, they're primary, meaning they arise gradually due to lifestyle factors like poor diet, lack of exercise, stress, and aging. Genetics also play a strong role. If you are a patient with hypertension, your own risk nearly doubles. If you have a parent with hypertension, if you have a family history of hypertension, your own risk nearly doubles. Secondary hypertension, which occurs for about 5 to 10% of cases, is due to conditions like kidney disease or hormonal disorder. There is a study in 2023 which indicates that over 70% of hypertension cases in adults are related to modifiable lifestyle factors, which we have already told, like sedentary lifestyle is one of the modifiable factors which can control hypertension.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
See, we should know that once we are checking the blood pressure, there are two numbers. One is systolic, second is diastolic. Systolic is which is above, diastolic is which is below the line. So usually we are saying that it should be less than 130 by 80. In fact, 120 by 80. But the latest guidelines from American Heart Association says that any blood pressure which is more than or equivalent to 130 by 80 is called as hypertension. So we should know our numbers. Numbers means we should check our blood pressure and we should know our blood pressure correctly.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
See, start with the basic lifestyle changes. It's very important that we should restrict our salt intake. It is said that we should take minimum salt of 3 grams per day. And some says that if we take less than 1.5 gram, it will be much beneficial for our health. So salt restriction is very important. Second is exercise. Exercise at least 30 minutes. 30 minutes brisk walk per day, 5 days per week. Or in other words, we can say that exercise brisk walk for 150 minutes a week. Third is that if a patient is obese, if just a patient is obese, lose weight around, if you say that patient loses weight, his BP is controlled around 5 to 10%. So it's very important to lose the weight. Fourth is, if someone is smoker or is taking alcohol, we have to quit the smoking as well as limit the alcohol intake. Then focus on DASH diet. DASH diet, what is DASH diet? Is a diet approach for stoppage of hypertension. It's usually rich in fruits, vegetables, and low fat.
Can we say that hypertension can be treated without medication?
See, if it's an early stage or there's a mild cases, in mild cases, if we take care of our body weight, lifestyle modification factors, definitely in early hypertension and in mild cases, we may not need drugs. But if blood pressure is very high or if there is existing organ damage or other risk factors like diabetes or kidney disease, medication is usually needed. About 60% of patients eventually require medications, especially with age.
Okay, doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
Once a patient is on antihypertensive drugs, it depends upon the nature of drugs which the patient is taking. For example, if a patient is taking diuretic, he may have increased urination and he may have low potassium, which is known as hypokalemia. Second is, if a patient is taking beta blockers, he may feel fatigue or cold extremities. Similarly, if any patient is taking AC inhibitors, he can cause a persistent dry cough. So if a patient is, if a patient suffers with these side effects, the advice is that he should not stop taking antihypertensive drugs, but he should contact his doctor. There is every need that he may need some another antihypertensive drugs. So side effects does not mean that he should stop his antihypertensive drugs.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
See, sometimes yes, especially if patient has done a significant weight loss and lifestyle changes. There may be some number of patients who may not need continuous antihypertensive drugs for lifelong, but hypertension is a lifelong condition. The goal is all to use the lowest effective dose and reassess regularly.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
For uncontrolled patients, daily checks, morning and evening, are necessarily. Then, when the patient has a stable, he may go for 2 to 3 times a week. Then there are many things which a clinician or a doctor should focus where checking BP. Like there should be adequate rest for the patient, because usually what we are seeing that patients are in hurry. They are coming and they are saying that, doctor, please check my BP. There should be an adequate rest for at least 5 to 10 minutes before measuring the BP. Then there are other factors like the width of the cuff, then the level of the BP apparatus. It should be at the level of heart. Then there are tubes in the these cuffs. It should be immediately to the middle tubercle fossa. These are other factors which usually every clinician and doctor knows. But usually what's happening in India, since India is a huge country, it composes around 140 crore people. There are not good number of doctors available. The doctor-patient ratio is very, very less in India. So most of the BP most of the blood pressure is checked by the non-professionals. What we have seen that they may not check it properly. My advice to the whole population is like that: please check blood pressure by an expert, which is only a doctor, at least once in a month.
I would also like to know what would happen if high blood pressure gets untreated for years, and what parts of the body gets affected the most?
See, already I have told that if there's an untreated hypertension, it damages virtually all organs, because this blood vessel, this artery goes to every organ of the body. It goes to heart and it may cause heart attack and heart failure. It goes to brain, causes stroke. Since kidneys has a good blood, blood supply, so there's every chance of CKD, chronic kidney disease. Then aneurysms means there is dilatation of the arteries, space dilatation, and there is sometimes rupture of these aneurysms, usually brain aneurysms. If there is sudden increase in BP, it can cause rupture of the aneurysms. There is vision problems. We have seen uncontrolled hypertension usually leads to blindness. Then it's a progressive threat. The longer it goes unmanaged, the more harm it does to the whole body, which I have already mentioned.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.